Ready to go now. Okay, everybody, thank you for joining us to do this prone. Can we just check that this is the lady that we're supposed to be proning? Check her wristband for me. Proning is a process that's been around for a long time actually, and helps to support oxygenation of patients with quite poorly diseased lungs. So we have practiced proning on here once a month for a good few years, so all our staff were well drilled in doing that, and we had produced our procedures and our paperwork to enable us to do that safely and carefully with our patients. When Covid-19 came, we weren't therefore shocked at having to do that. We were able to come together as a team, support each other, and know that we were doing things safely and considerately for our patients. The proning procedure is a very well organised procedure, and what we want to do is make sure that the patient has all the things that they need and the right team around them to do it. And we will need to wear full protective equipment now to do it, because the chances of a patient being COVID positive are very high that needs this procedure. We'll make sure that the relatives are aware that this is going to happen. We'll make sure the relatives are aware that things that can happen like swollen faces and sore eyes, and we do our best to minimise those things during the procedure. Before we do the procedure, the patient will have had a full wash and a full check to make sure that they haven't got any pressing or urgent nursing care needs. Okay, just before we came in, did you clean her teeth and change her ET tapes? Yes. Thank you. And it's 58. So they'll have the teeth cleaned, the tapes will be secured, any dressings will be done, and it's a planned procedure so that we know that we can be as safe as possible. We need to make sure there's enough drugs to sedate the patient and keep them comfortable. We need to make sure that there's enough vasopressors to make sure that they don't run out during the procedure. While we do the procedure, we have limited monitoring on the patients. So it's very important that we understand what those things are and how they are to be kept in place. Normally we would have quite a lot more monitoring on a patient. And moving a patient is when they become the most unstable. The easiest way to describe it is that we wrap the patient up like a Cornish pasty in the sheets. And the staff roll the sheets together in a particular way, and then we talk to each other about which way the patient is going to roll, and that's a set procedure. But the patient is tightly, snugly wrapped up and moved in one easy move and then repositioned, so we have everything checked out.
Ready, steady, slide. Ready, steady, roll. Everyone all right there?
Okay, swap arms.
Right, ready, steady, roll.
So at the end of the procedure, we will go down the checklist to make sure the patient is safe in their prone position, and we will talk to the team, make sure that they're happy, and the person who's staying with the patient, the staff nurse, will know to get on with their jobs to make sure everything else is safe. We usually give the relatives a ring to say that the procedure went safely as well. Each month the staff actually prone me as part of their training, so they don't just practice on a mannequin, they actually practice on me, and I can tell you that it is very secure.